Welcome back, Richard. It's good to see you. I missed you last week.
Oh, tell us about last week, Dr.
You know,
Goodman.
I had I had to have some dental work done, and so we all none of us wanted us to be recording last week because of that. So it's good to be back, right?
You would have been drooling.
I've
No,
just been
you
sitting
had some,
here.
yeah, you had serious dental work and then they put you on all those drugs and everything. So,
Yeah.
yeah.
So
But it took you a long time to recover.
I'm close to recovered now, but it's
Yeah, I
good to
was
be back
surprised.
and to see your smiling
Beautiful
face.
face. My movie star good looks.
That's
Hey,
right.
what's the date today? February 24th. Somebody told me the other day, she said, yeah, we're coming back in March. And I thought, March? Then I realized March is next week, right?
Yeah.
The next
Yeah.
podcast we do, it'll be March.
It sure will, and we're flying through the first 2 months already. But you know, and today our topic today, I think, is going to be the start maybe of a few weeks where we talk
Sure.
about the topic of memory, and recently there was this. We try to avoid a lot of political talk on the podcast for
Right.
many reasons. For obvious reasons, it just is so divisive, and we just don't want to get into there and let some of those kinds of issues cloud the information we're trying to share with everyone. But
Right.
recently there was the report from the special counsel about President Biden's handling of the classified documents and stuff. And in that report, they talk about his memory, and President Biden's memory has been on the forefront of conversation in a lot of the 24-hour news cycles recently. And so we thought that this would be a great opportunity to kind of talk about that a little bit and really address what memory is and what forgetting
Right.
is and what memory impairment is, and kind of focus on that topic a little bit today.
Yeah, this story exploded because of HER's report, and I looked at it, and it's very easy to politicize these things.
Right.
There are obvious political implications in what he said. He made comments like, "President is a sympathetic, well-meaning, elderly man with a poor memory," and yes, there are political overtones there. But I thought, let's talk about memory. It gives us a perfect opportunity to delve into this topic. It's something that most of us don't know very much about. There's a lot of there are many misunderstandings about memory, and so we thought, well, this is really provides a good opportunity for us to talk about this,
Absolutely.
because what the special counsel focused on was that Biden was unable to remember in that interview. He said Biden was unable to remember the date of his son's death and the years of his vice presidency. But and then we could talk for a long time about those two things. But what it's important to remember is that they were interviewing Biden about the documents. That was the topic that they
Right.
were interviewing him. So for them to switch to a different topic, that is any topic, it's not his son's, it's any other topic.
Right.
You have to shift attention very quickly. And that's something that none of us do well. Even young people don't do that well, because you have a context. And Bernie, you said when we were preparing this, you said if you meet somebody in a different place,
Right.
you know, you have to search your memory banks to say, where do I know this person?
Absolutely. I mean, think about your kids. Your kid goes to school every day.
Right.
Their teacher very well, but then one day you're in the grocery store, and then here comes the teacher walking up, and your kid's like, "Wait a minute, what's going on?"
Right.
Completely out of sorts. And so context is so important, and so you're absolutely right. There, while this report from Robert Herr has a lot of information in it, some of it with very strong political undertones, the attack, the conversation or the points made about memory, we have to look at those within a particular context. We have to look at those as it relates to what is typical, what is expected, what is what is normal in different circumstances as it relates to a person's memory. They talk about the you said he's described as sympathetic, well-meaning elderly man with poor memory. And in no way is this meant to defend Joe Biden, but at the same time, I mean, he is many of those things. But to talk about memory, I think that we often on this podcast talk about the dangers of diagnosing and just throwing diagnoses out. And so to say that because somebody forgot a date or couldn't remember a date or something and say, oh, well, then he must have a poor memory, I think is dangerous. And we have to be careful that we don't jump to some of those things too much. And again, that's why I think it's really important that we're talking about this today, because look, man, we all forget sometimes. We all forget things sometimes.
Well, when I first saw that sentence, I said, an elderly man with a poor memory. And you think, now some people would say, yes, he has a poor memory, and they take that, they extend it out. My first thought was, wait a minute, what do you mean he has a poor memory?
Right.
Who made that diagnosis? Because Bernie, when we are asked to do those diagnoses,
right,
with people who have what looks like the beginning of memory loss, the elderly, the 60, 70, 80-year-olds who have that, it's a very difficult, it's a very tricky diagnosis to make. And you have to do a battery of neuropsychological tests to determine that. It's especially in early memory loss, the beginnings of memory loss, it's very difficult to differentiate whether it's just normal aging or if it's some the beginnings of some dementing disorder. Right. And so just to throw out that he has a poor memory from a psychological, neuroscientific standpoint, that raises all kinds of questions. What do you mean poor memory? Who made the diagnosis? How did you determine that? So these are all questions. And then you say, well, wait a minute, maybe we ought to take a look at this and take a deeper dive into memory and say, let's look at memory and try to determine exactly what Biden did or didn't do. Right. Because the other thing to remember is that this interview occurred 2 days after Hamas attacked Israel, after that bloody invasion. And so the president did have other things on his mind. I mean, sure, to be fair. Absolutely. And so to say that somebody has a poor memory raises a number of other questions. And we thought, well, this is a good time maybe to address some of those questions and bring us all up to date on what it means to have a poor memory or a memory disorder. Right.
Yeah. And again, the last comment about the as it relates to Biden is because when people make those kinds of statements, other people begin to expound from that. And exactly. I don't know if this has happened to you, but I've had a number of people that I work with, patients and stuff, who come in and, they're frustrated with the way that things are at this time. And they'll say, well, that report came out and said that, well, since he's an, elderly man, with poor memory, they're not even going to charge him with things because they said it won't even matter because he doesn't remember anyways. And it's like, no, the report didn't say that at all.
Right.
But because, people take this one piece of information and then they extrapolate from that to all these other things, it's just, again, very, very, very dangerous, I think, at times to make some of those generalizations. And so when we think about memory, it is important to remember that we all forget sometimes, and really important to remember that, most of us start to show some forms of decline in our memory as early as our 30s.
And people need to understand that, right. That this decline that we're talking about, we talk about normal aging, right? Because of normal aging, that begins in our 30s.
Right.
Okay. You're never going to be better than in your 20s. Okay?
Right.
So if you're going to do something important, you better use those, not to travel around Europe with a backpack, but those are your best cognitive years, or in your 20s. So
Right.
don't give those away. And you're right, the decline begins in our 30s, and people don't realize that.
Right. And so when we think about memory, the one of our memory structures, one of the structures in our brain that really is, a linchpin, a very important component of memory is the prefrontal cortex. And,
Right,
as we've talked about before, the prefrontal cortex is really the last area of the brain to finish in development, but it's also the first area of our brain that is the first to degrade. It's the first area to start to
right,
decom deconstruct or lose some of its effectiveness and lose some of its efficiency. And
right,
so that's all of our executive functions, like working memory and inhibition and attention and some of those kinds of things. So
right.
it's the last to get fully developed and the first to start going away.
And that's very important. People, you all know, because you've all heard that the brain doesn't finish maturing until we're in our mid-20s. You've all heard that on the news. What's developing is the prefrontal cortex,
Right.
but it looks like it's also the first to begin to degrade and to lose functional capacity. And all the things we're talking about, working memory, inhibition, selective attention, all those things are housed in the prefrontal cortex, in the frontal lobe of the brain. And so as we age and as the frontal lobe begins to degrade, all those things diminish, all those functional capacities begin to diminish. And so if you're over 50 or 60 years of age, you tend to be more distractible. You tend to be less attentive. Processing takes longer. I have a relative who asked, he's in his 60s, and he asked me, am I getting this or am I getting that, or do I have Alzheimer's? I said, no, processing takes longer when you're older. Walking takes longer at 70 than it did at 20.
Right.
Anything you do takes longer at 70 than it did at 20. It's no different with cognition. It takes a little longer at 70 than it did at 20.
Right. And we just to draw some comparisons, because we tend to, again, thinking about this report and all about President Biden, we look at that and we say, oh, 83, and he's elderly and he's this and he's that. I mean, he's the same age as Harrison Ford and Paul McCartney and
Right.
so we don't necessarily question their competency. Harrison Ford remembers lines to movies, and Paul McCartney remembers the lyrics to the songs, and he writes new songs, and he's, all of these different things. And so the age in and of itself isn't necessarily indicative of any particular impairment or limitation. And so again, we just have to be careful when we're thinking about, attributing something just because of age.
Right. And the other thing is that we have to be cautious that we don't judge a person's mental capacity, their total mental capacity, on a single part of their memory system.
Right.
And so memory is relevant, of course. It's important that you remember these things.
Right.
But there are other factors. There was a fellow interviewed the other day, and he's been in Congress for years, been in leadership positions for years, and he said, the young are needed for their strength and the elderly are needed for their knowledge and their wisdom. You need both. And so as you age, you also develop maturity, emotional regulation, knowledge of relevant facts. And all of those things are preserved and probably improve with age. So the elderly have abilities and skills and knowledge and information that youngsters just don't possess yet. Okay.
Absolutely.
So it's more than just verbal memory. And when we talk about, and that brings us to the next point,
Right.
that what we're talking about in this, when he talks about he has a poor memory, he has diminished verbal recall, which is normal, all right? But that's only one of three memory systems in our brain.
Right.
We have three types of memory. You have motor memory. You don't forget how to brush your teeth. If you live long enough, you'll probably forget how to do that. But you don't forget how to make coffee in the morning. You don't forget how to cook an egg. Those are motor memories. You also have episodic memories, which are the episodes of your life. You recall birthdays and significant events. And then there's verbal memory. And that's what we're talking about with Biden. So we're only talking about one part of a complex memory system. And it's still, even memory is only one part of a larger cognitive system. So we're talking about a splinter of all these cognitive abilities.
Absolutely. And for those who want to look more into this, some other names for those three memory systems is what you're referring to as motor memory is also called procedural memory, episodic memory, and then the verbal memory is also called semantic memory.
Right.
And but yeah, it's you remember how to do things. You remember, remember how to drive a car. And if you want to like test your procedural memory, get into a car where the steering wheel is on the opposite side.
Right.
And then all of a sudden you're having to remember everything all over again because that procedural memory is then being put to the test. And but otherwise, you get in and your body just moves because it knows how to follow those procedures.
Brush your teeth with your non-dominant hand.
Right.
And you realize, okay, so you got this memory in your hand,
Yeah. So there's three types of memory system. And when we talk about true memory impairment, we tend to talk about limitations that sort of span across various all three of those different areas. People start to have problems with all of these different types of memory because their brain isn't accessing those memory systems the same way. It's not, man, I know I forgot the date of when that happened, or it's, I can't remember her name. That's not a memory impairment. That's what we're getting to next. And that's forgetting. You forgot a person's name. It's not a memory impairment. It's not a memory loss.
Right. I like the way one author put it. He said there's two types of forgetting. There's a forgetting with a small f, and there's a forgetting with a capital or major case F. And when we talk about senior moments, we're usually talking about small f.
Right.
But small f it's that tip of the tongue phenomenon. Like I know what it is, but I just can't remember it. Or you have it somewhere, but you just can't retrieve it. That's a retrieval problem. Okay, that's it's there somewhere. You just can't retrieve it at that moment. And that's happened to all of us.
And that's oftentimes a contextual issue, like we were talking about earlier.
Exactly.
It's, if you're used to seeing someone or doing something in a particular context, and then all of a sudden you're exposed to that in a different context,
right?
Your brain has to work a little bit harder to put those pieces together for you to make those connections.
Right.
That's not, capital forgetting. That's just your brain is taking a little bit extra time to put those things together. That's not a neuropsychological problem.
Yeah, if you're working on some complex task and you're completely absorbed in it, and somebody taps you on the shoulder and asks you a question, it's going to take you a minute or more to transition to that new topic. Okay, you don't just spit things out like a supercomputer. The way our brain works is you have to redo the context. You have to capture that new context and then retrieve that information. So this is the typical stuff that we laugh about. I lost my wallet. I lost my keys. Where are my glasses? Oh, Dad, they're on your head. You look all over the house and you're wearing them. That's normal forgetting that happens to everybody. Starts in your 30s and it goes across the rest of your life. That's different from a memory that is not there, that's lost or gone, or you could not make the new memory. When we talk about Alzheimer's, we're talking about individuals who whose brain structure has deteriorated, the structure that makes new memories deteriorates. It just breaks down. And so they can't make new memories. They can remember old memories, but they can't make new memories. And that is the capital F forgetting.
Right.
You don't, it's not that you can't remember the person's name, you don't have any recognition of the person, or you have no memory of ever meeting that person before. That's a different kind of forgetting. That's the kind of, that's not what we're talking about if you can't recall a date at a particular moment in time. So
Absolutely.
yeah, understand that there are two. Biden couldn't recall his son's date at that moment, but he knows that he had a son. He knows that he had a son who was killed. He knows that they have a service for him every Memorial Day. And so he has memory. He's not, that's not the issue, okay? And this brings us to an interesting question for all of us. So what is the difference between normal aging, cognitive impairment, and what we refer to as dementia? And I think that's what most people, especially people over 60 or 65 or 70, and their family members, I think that's the important question that people are asking today, is what is normal aging, what is cognitive impairment, and what is true dementia?
Absolutely. And as you can imagine, there's some the lines are a little bit blurry sometimes because well,
And-
first off, what is normal? Who knows what normal is?
Right.
But there are some anticipated declines that happen as we age. We said earlier that people, we tend to start forgetting things in our 30s, and
Right.
this this just there's a slight increase in that curve as we get older. Um,
Right.
and so we experience memory loss along the way, and it continues to increase as we get older into our 60s and 70s.
Right.
But it's typical, it's not really noticeable. It's like, oh, it takes dad a little bit longer to remember this, or mom keeps calling me my brother's name, or something like that. Now she knows that you're not your brother. She knows that she has two sons, but she calls you your brother's name because it's just those connections maybe aren't as quick or as fast as they once were. But a lot of that is just typical normal aging.
Right. My kids laugh at me all the time because I rarely use the right name with any of the kids, and they'll laugh. And I say to them, I said, look, as you get older, you have more stuff to think about. You have more obligations. You have more stuff to think about than you did in your 20s. 20s is a blissful time. You're thinking about yourself, and you're thinking about what you're going to eat and where you're going to go out and who you're going to be with. When you get to your 50s and 60s, there's a lot of stuff going on, and so you can still do the same stuff, but there's a lot more clutter that you have to work through. So processing takes a little longer. So as far as normal aging is concerned, we do our best in our 20s, declines after that. 40% of us will experience some degree of memory loss after age 65. It's just normal. All the declines, hearing, vision, they all decline after that age, okay? So why should memory be any different? In Canada, they call this age-associated memory impairment, AAMI, age-associated memory impairment. So you can have trouble with remembering where your glasses are, but it's not disrupting your life in any significant way. You can still work, you still have family functions, you remember birthdays, you can still drive your car. So in age-related memory impairment, what we call senior moments, you can still function. You can complete tasks like cooking and baking and laundry and all those things. You can still learn new things. People, learn a foreign language, learn a new sport, learn how to do something. And there are no medical conditions causing your memory problems. And I think that's going to be an important distinction when we talk about the dementing disorders, because there is some underlying cause in a dementing disorder that doesn't I'm at an age where, yeah, I'm forgetting stuff, but I don't have any disease process. I don't have any known disease process that's causing it. So I'm in that age-associated memory impairment, but anybody over 40 is. Okay.
Right.
So that's the first one. That's normal aging. That's not going to be a problem for most people.
Right. The second level is what's called mild cognitive impairment, MCI.
Right.
And what mild cognitive impairment, now we're talking about, the memory impairment is getting it to be a little bit more serious to the point where other people are noticing it. They're recognizing that, man, you're really having a hard time. You have no memory that we had breakfast this morning. Or you don't recall that we arrived last night for the visit. You're still able to go to work maybe, and you're still able to do some of those kinds of things, but family and friends are starting to notice that you're forgetting some things that may be important in life. And at this point, now you're starting to see some of these memory impairments show up on like neuropsychological testing. You can still do most of your daily tasks, but when it comes to forming new memories and when it comes to, that ability to recall things from the past, you're starting to have a little bit more difficulty to the point where you're needing some extra help or needing some extra support because of that memory loss.
Yeah, I think this mild cognitive impairment from a personal and professional perspective is the most difficult to
Yeah.
judge.
Yeah.
And so what we say to people are the memory losses becoming more frequent? It's okay. I left my wallet in a pair of shorts the other day, okay? But I knew enough to look for it later in the day. I knew I was going out and I said, oh, shit, I need my wallet. And so then I had to go back. So yeah, I forgot to take it out of my shorts, but I remembered a few hours later that I need it if I'm going to go grocery shopping. Okay. But if the episodes of forgetting are becoming more frequent or they're getting worse,
Yeah.
then even familiar things are becoming more difficult for a family member. Then you're probably moving from age-related or age-associated to a cognitive impairment. Okay, and that's the best that we can do. Is we simply say you can still do most daily tasks, but everybody's beginning to notice that the memory lapses are more frequent and they're a little longer, and you're not recovering as quickly. And that's the best we can do.
Yeah.
At that point, now you probably have to have some assessments. If you're beginning to suspect that a family member has that kind of memory loss, then you probably ought to consult with a medical professional, because you're going to want to do some brain scans to see if the person is experiencing strokes or has a lesion, has some kind of damage to the brain. So now you want to start looking for some underlying cause.
Absolutely. And ruling out other things, medical things like thyroid problems and depression and some of those kinds of things. But yeah, as this mild cognitive impairment progresses, 10 to 15% or so will start to develop, dementia within a year or so. And about a third will within the next 5 years.
But Barney, that's an important, you say 10 to 15%, but remember, 85 to 90% won't develop dementia. Okay. So again, we're talking about, even if you have mild cognitive impairment, there's a better than even chance that you have a pretty good chance that you're not going to develop a dementing disorder.
Right. Now, when it comes to dementia, this is one of those that we probably need to spend an entire podcast on, because dementia, people tend to think of dementia as a thing. Dementia is a diagnosis, and oftentimes people, use dementia synonymously with Alzheimer's, for example. But there are actually many different types of dementia, and basically what dementia is a medical condition, is a medical disorder that is where memory is impaired, cognitive functioning is impaired, but it's impaired for a particular reason. Alzheimer's has to do with these plaques and tangles that form in your brain. We're not even necessarily sure how it really happens. And, many of you may not know that, Alzheimer's cannot actually even be formally confirmed until after the person has passed away and there's been an autopsy to look at the brain, the brain structure itself. But there are other types of dementia like Lewy bodies and vascular dementia and Parkinson's and some of these other types of dementia that have profound effects on people's functioning. But they're different than Alzheimer's. They're different than other types. So it may be one of those things that we really need to spend some time on in another podcast. But what about 5 to 8, maybe 10% of people develop dementia? Dementia at a level where it's really impairing their functioning and their life and different things. So it is a significant thing to be concerned about.
Right.
I lost my grandfather due to complications with Alzheimer's, and so it's horrible to watch the disease progress. But it's very different than some of the typical aging that we've talked about, and even the mild cognitive impairment that we just talked about.
Right. Yeah, it's a very different. In fact, in DSM-5, in the latest edition, this is one of those rare disorders that we can find we can do a test.
Mm-hmm.
For most disorders, depression, anxiety, ADHD, there's no medical test.
Right.
Well, for the dementing disorders, there are medical tests. Sometimes we can't do them until autopsy, but there are ways to determine we have tools to make we can say this is what's causing the disorder.
Right.
But the important thing to remember with the dementing disorders, that's a disease process. It's not part of normal aging. It's not part of normal anything. It is a disease process, and it has nothing to do with normal aging. And again, probably 10% or fewer people will have a true dementing disorder. But these are complicated questions that we're only beginning to understand. So I think maybe in a future podcast, we ought to talk about it in more detail, and sort of fill in some of the gaps and sort of present a more comprehensive picture of this process, this aging process, and the disease process that affects at least some of us.
Absolutely. So be patient, be calm, relax.
Yeah, don't jump. When you hear he has a poor memory, I don't think her's a neuropsychologist. I mean, you have to be very careful when we see these things. What do they really mean?
Right. Yeah. And if you're having any problems with your memory, or if it's becoming concerning, talk to someone, have an evaluation, see a neuropsychologist or a neurologist, or see someone, talk to your primary care physician about your concern, and be evaluated, see what's going on, make sure if it's something to be concerned about, or if it's just part of normal aging,
Right.
and and then proceed from there. So, all right. Well, that is it.
Very good.
We'll be back next week. And until then, stay happy, stay healthy, and forget to be afraid.